Every country has its good clinics. It's good, it's excellent clinics, it's good clinics, and it's really don't go there clinics. And that goes for every country. So if a patient wants to have treatment on the basis of cost alone, there are going to be pitfalls. Nothing worthwhile is cheap, because time is not cheap, and the skill of the people doing it is not cheap. So if somebody is going to a clinic abroad for treatment that is going to cost a quarter of what it costs in the UK, you really have to ask yourselves, are they getting the same thing? And my usual response to somebody who says, oh, I can get an implant or a crown or something done abroad for this, is like, yes, but it won't be me doing it. And it won't be me, it won't be my knowledge and my skill set that's being applied to that. For sure you can get it. But I think most people understand at a very basic level that you need to pay for quality, because we need to pay for quality. If you're in an environment where you are running a quality practice with good quality staff and your colleagues are of a high caliber, it is an expensive endeavor. It's an expensive endeavor to run a business that is patient-centered. Anything bespoke is expensive. You have a bespoke suit made, it's more expensive than an off-the-rack suit. So it's simply a case of, do you want an off-the-rack suit or do you want something bespoke? And in some cases, off-the-rack is fine. And a lot of patients go abroad and they have, quite successful treatment that they're happy with. Whether it would make us happy or whether it would reach our standards is another matter. So there is no right or wrong. There is certainly a spectrum of treatment. But I would say if you're going abroad to have treatment because A, it's fashionable, or B, because it's cheap, those are really not the best reasons for making a decision to have treatment. And I think they would fall foul of any consent process that goes on in the UK that tells you, that where we have to relate to the patient what the pros and cons of treatment are. And also, if you are going abroad to have treatment, is the long-term care of that patient really the paramount concern of the clinician providing the treatment, or is it being done just really as a financial transaction? So for me, it doesn't sit well. My job is to look after my patients for a long period of time. I want to be able to look at my patients 5-10 years down the line and say, look, what I did is still standing up to scrutiny, and I'm very proud of it. And I always say, it's something that my nurses will have heard me say, is like, on my very last day of practice when I retire, I just want to have a whole day of checkups where nobody needs anything doing, and I know my job has been done. So I think dental tourism is here to stay. It's going to happen. There are some horror stories, but there are also some reasonable treatments, and I'm not denigrating my colleagues at all. Those that are conscientious will achieve a good standard. Those that are not conscientious will not achieve a good standard. And those who live and breathe it and for whom it's a calling will achieve the best standard. And that's really what we aspire to. That's what we're trying to do. And if that's important to you, then this is the practice for you.